I have an experience of about 10 years in the field of women health, ranging from menopause till adolescence. I would first like to thank Baby Chakra and its entire team for giving me this opportunity to share my on their platform. Wishing all you viewers and the entire team of Baby Chakra a very happy Diwali and a prosperous new year. Now, before I start the session, I would advise all the viewers to download the Baby Chakra app and to follow me using the referral code SHWETAS. You can also follow me on my social pages, that is Instagram and Facebook, on the following address drshweta.social, and also on my website www.drshweta.com, where I keep on posting interesting updates on women health, and that is an easier way to connect with me personally. Now let's start for today's topic. आपने बहुत बार सुना होगा कि आपके बड़े लोग आपको बोलते रहेंगे कि कि दो बच्चे तो होने ही चाहिए, दूसरा बच्चा you should plan immediately after the first pregnancy, and the earlier you plan the second pregnancy, the better it is, as both the kids can grow together, they will learn caring, sharing, and so on and so forth. Or if you're planning a second pregnancy and you are too nervous or too anxious and you have a lot of questions regarding how to approach it, then this is the video you should watch, where I will be answering majority of their questions. Now I'm going to break this session into four important categories. Now the first important category is the physical readiness of the body of the mother. Now, pregnancy itself is a journey of 9 months, and in this 9 months, there are various changes occurring at various levels. And not only in pregnancy, even after pregnancy, that is your post pregnancy and breastfeeding, there are numerous changes which are occurring. Now, during these stages, that is in pregnancy and after the pregnancy, in the breastfeeding phase, a lot of nutrients are passed from the mother to the baby. Now, the body requires around 2 years' time to replenish this lost nutrients in the mother. Also, after in this 2 year span, there is an internal healing which is happening in the woman's body. If you have undergone a normal delivery or if you have undergone a cesarean section, the healing time for the blood loss that has occurred for the stitches to heal is around 2 years. Then your cycles return back to normal, so your hormonal changes also set into the cycle as they were before. So it is the 2 year time gap when your body is physically fit and it is physically ready to undergo a second birth or a second baby, so that that does not affect the health of the second baby. So as per WHO guidelines, the minimum time gap between two pregnancy is 18 months, but in my personal opinion, it should be minimum of 2 years for the reasons I just discussed. Then the second category that I need to talk on is the financial readiness. Now, with the things getting expensive in today's world and the level of lifestyle that has gone tremendously high as compared to previous days, we all want to give the best to our children. Best in terms of, let it be from skincare to schooling to toys to clothes. We don't want to compromise a bit when it comes to our children. Now we may compromise on ourselves and we might have take that additional financial burden, but we try to give the best to our child. So if you are very clear from the start that you want to plan a second pregnancy, then you should keep your finances clear, you should arrange your finances home. Otherwise you will have an additional financial stress when you are planning a second baby, and also it means that you might not be able to give few things which you used to give to your first baby. So there has to be a fine balance which has to be maintained between planning a second pregnancy and the financial aspect of the house has to be arranged, because as soon as you conceive, your expenses are going to be high. Third important thing to discuss is the emotional readiness. Now, there are multiple scenarios taking place in everybody's household. First is, you may be ready or your partner is not ready for the second child. The partner is ready, but you may not be ready for the second child. You both are not ready, and there are familial pressures, or you both are ready, but the family is not ready. In my personal opinion, when you are planning a second child or when you are getting a new life into your family, I feel that you all should be in a mental sync on the same page on this aspect. So, for this, you have to sit down and talk that how a new life you are getting into this world or, in fact, in your home is going to impact your family, whether you will require some additional help, or you might require someone from the family to help in, or you might require a domestic help, and how you are going to all, you know, together welcome this new life into your life is the most important thing on my personal view. Then the last thing is, and the most important thing is, how do you prepare your first child for the entry of a new member into your family? And this is the most important aspect. So that is why I told you that a minimum gap of 2.5 to 3.5 years between the two pregnancy is necessary for the following couple of reasons. First thing is, a child who is about 2.5 to 3.5 years can talk, can communicate, can respond, and can understand what you were trying to explain. So even if when you are busy with the second child, when it comes, most of the times you are busy into breastfeeding, you will focus more on the second child. When you sit and tell your first child, they have more readiness to accept, and they will take things lightly and easily. Even if you don't give that much of attention to your first child when you are busy with your second child, and if your first child is under the care of a caregiver, that child can communicate well with the caregiver to know what they want, what they demand, and so on and so forth. So that is why a gap of 2.5 to 3.5 years is very important. The another reason where this gap, where a child of 2.5 to 3.5 years is more independent, he's walking around, he's talking around, he's doing things independently. You need not hold a 2.5-year-old child constantly with you, because as soon as you get pregnant, your doctors might advise you that you should not lift heavy weights. So a 2.5 to 3.5-year-old child is more independent. You need not lift the child all the time. The child will not become cranky, will not have behavioral issues, will not become aggressive if this transition period is very well handled. Another important thing is that your second child doesn't require too much of attention in the first 6 months. What the child demands is only the couple of feeds that has to be taken care of, and the sleep patterns have to be taken care of. Your first child by that time has learned to go to school, so he has a fixed schedule, so that you can also plan your schedule according to the first child schedules. That is, for example, if the child is gone to school, in that time you can give more time to your second child, you can finish all his routine, make him go to sleep, and by the time the first child comes, you can spend time with the first child, so that the first child doesn't feel that he has been neglected or he's not been given attention as he was given prior, and so on and so forth. So you both as a couple need to plan, because your first child will should not feel left alone when you are busy in your second child. Then, coming to your personal relationships as husband and wife. Now we know that with the first child only, there is not much of a time left initially in the 6 to 7 months when the baby is small. You don't have too much of time for each other. So that is why this is when the additional help or a nanny or a maid can help you with the other things around, so that when both the children are taken care of, you can also spend some time with each other. If that is not taken care of, then there are a lot of frustrations, depressions, relationships start souring, and there are many other issues. Then I will talk on the medical aspect now, that what things as a couple should be done before planning the second pregnancy. Now, for both the husband and the wife have to be in a good health. Good health, I mean, they should have good lifestyles. They should have a good. Hello, am I audible? Hello. Okay. The next important thing is that you have to avoid a few things in your lifestyle like smoking, drinking, and other hookah or anything of that sort has to be stopped. Then you both have to take few supplements and few antioxidants. The reason why I'm telling this right now is because of the ambitious nature of the women, late marriages, more work pressures, the first pregnancy itself is delayed. So by the time you come to the second pregnancy, the women is already around 35 years of age in today's generation. So you require to take supplements in the form of folic acid, or you require to take micronutrients or other kinds of supplements in small amounts so that there is good selection of the egg and the sperms for the formation of the embryo. Then, the last but not the least, if you have had a previous history of a depression in post pregnancy or a postpartum depression, then you need to recover from it before you take a decision of going into the second pregnancy. And this has to be discussed with your gynecologist that you had a previous history of a postpartum depression or a postpartum blues. If you have some medical condition like a diabetes, an epilepsy, and asthma, then there are few drugs which are not allowed to be taken in the first 3 months of pregnancy. And therefore, you have to visit your physician and you have to tell them that you are planning for a second pregnancy and they will switch over to the drugs which are safe in the second pregnancy. Then there are few blood tests which will tell you that how fit your body is that you might undergo a second pregnancy. But as I discussed, in majority of the cases, a minimum time of 18 months, 2 years is the best time to plan a second pregnancy, because by that time the women's body is entirely fit to take the burden of a second pregnancy, and in most of the cases it goes well. Thank you so much. Any questions further will be addressed by me. You can please ask any further questions. The first question asked it, is it easier to conceive a second child? Now, conception of a second child depends upon the age of the woman, especially if the woman is above the age of 35 years, then she will surely require some doctor's help to conceive or plan a second child. If the woman is in the age group of 25 to 30 years when she is planning the second child, then usually there are no problems. So, age is the most important factor when you are planning the baby, especially the women age. How do I prepare for a second baby? That is what I told you. Most of the things were covered. There are the things that have to be covered is first is your emotional readiness, physical readiness of the body, your financial securities in the home, and how do you prepare your first child for the second baby. That is what I told you just few minutes back. That first is the minimum gap, that is about 18 months to 4 months, but in which the women's body gets completely healed, it completely recovers from the changes of the first pregnancy, and that is the ideal time to plan the pregnancy. Also, your child who is about 2 years to 2.5 years will manage or will understand what is being a mother, and if you tell them, you explain them, they will respond and they will connect well with you because they have some kind of understanding that is developed by that age. What age is best for a second child? That is what I told you, that in today's world there is no age limit, as women are getting involved in late marriages, they have work pressures, they become too ambitious. So the ideal age of getting the first pregnancy done is between 25 to 30 years, but this is not followed right now. The first pregnancy only happens after 30 in the age group of 30 to 35 years. So by the time, if I tell you that you have to give a span of around 18 months to 2 years for second pregnancy, so that comes to around 37 years for a second pregnancy. So the ideal age or the best age for a second pregnancy is in the age group of 30 to 35 years. Is it better to have one or two kids? Now, this is personally your choice as a couple. But in today's world, I told you that majority of the people are planning their first pregnancy only late. So there is no time, or they are so involved in their own work pressures, into their other commitments, that they don't think of about the second child. On children point of view, if you think, see, now I am having an elder sister. So I, anytime if I have any issue, I connect with her well. I know I have someone to share my problems with some problems which I can't share with my parents, but I can share with my sister. So having a sibling is always a security. Children learn to share, to care, to understand each other better. They don't become introverts, they get along with each other well if you have a second child. So that is your personal choice whether you want one children or two children. But on ideal terms, if you ask me, in my experience, it is always better to have a sibling. What age is hardest to get parent? The age above 35 years is the hardest to to get pregnant, because after the age of 35 years, your ovaries or your eggs undergo aging, which is a natural phenomenon. It is set by God like that. That is not in our control. Therefore, I always advise all my patients to become pregnant in the age group of 30 to 35 years. Do you gain more weight in your second pregnancy? Now, this depends on your pre-pregnancy weight. So if you immediately plan a second pregnancy after the first pregnancy, and you have not allowed enough time for your first pregnancy weight to go, or if you have not allowed enough time for the changes that happened in the first pregnancy to resolve and return to natural, then there is a chance that you might gain an additional weight in the second pregnancy, because you did not allow that the weight or the changes of the first pregnancy to regain to norm. Why I am so tired during my second pregnancy? Each pregnancy is different in its own terms. If the planning between the first pregnancy and second pregnancy is not proper, means it is not in the gap of around 18 months to 24 months, your body hasn't healed the previous stress, and therefore the second pregnancy is not taken that healthily by the body, and you get symptoms of anemia. Your hemoglobin goes low, and once your hemoglobin goes low, you constantly feel tired, you feel weak, you are feeling lethargic, you don't have interest in any other things, and you feel like lying down always. So that is the spacing between the two pregnancy is important in this case. How are second pregnancies different? Now, every pregnancy is different in the sense that your body has experienced the journey of pregnancy in the first pregnancy. So your body is now tuned to what changes will happen as far as pregnancy is concerned. So in most cases, what symptoms you had in the first pregnancy will not appear in the second pregnancy, because your body has revived that first change of pregnancy. So in that case, your body gets accommodated to the second pregnancy very easily than does it with the first pregnancy. For first timers, it is new for the body because it has never experienced pregnancy. So that is why the first pregnancy is, the second pregnancy is better tolerated than the first pregnancy, because your body has gone through that changes for the first time. What does a second time mom need? A second time mom doesn't need anything great. She only needs to take a rest. She only needs to divide her time properly between the first child and the other household chores. The same iron, calcium tablets are required. She has to have good nutrition, good rest, because here the time is divided between her family and between her first child. So that is why I would advise that when a mother is planning her second pregnancy, it is better that she has some help in the form of a domestic help or some family member supporting her or her husband supporting her, because this time she has to take care of the first child also, plus she has to take care of the second child who is in the womb, and that is not an easy task. Is it harder to lose weight after second pregnancy? See, in this world, nothing is hard. It is for losing weight, you require good motivation and a good and strong willpower. Nothing is hard. Trust me. You have to have that willpower and that motivation to lose, and you will lose weight provided you follow the instructions that are given to you by your nutritionist or by your trainer. You have to have a proper trainer and a proper nutritionist. It is only after that that you will lose weight. Just the thought of losing weight doesn't cause weight loss. You have to actively participate in weight loss. Do breasts hurt after second pregnancy? Yes, in the initial breastfeeding period, they may hurt because of the hormonal changes which are induced in the breast in the second pregnancy. Now, if the time interval between the first and the second pregnancy is not in the range which I told you, then whatever changes will happen in the second pregnancy will get exaggerated, because the first pregnancy changes have you haven't given that enough time for them to resolve, and you immediately plan the second pregnancy. Therefore, you might have extra issues of the second pregnancy. Do second babies come earlier than delivery time? Yes. Second babies do come earlier than the delivery time taken for the first baby. The reason for this is that your first pregnancy has induced certain changes in your vaginal birth passage and also into your uterus. Therefore, those changes remain, and it is easier for the second pregnancy to happen fast, because the dilatation, I mean the opening of the mouth of the mouth of the uterus is already, it has undergone that stage. So this time it becomes more easier and it happens earlier than the first pregnancy. So the first time, the delivery time for the for the women who is pregnant for the first time, the delivery time is from the time the labor begins till the time the delivery occurs is around 12 hours. And that 12 hours is reduced to half of around 6 hours when a woman delivers for the second time, because some changes which are required for delivery have already been taken care of in the first pregnancy. So those changes need not occur again, and therefore that much of time is saved. So, my takeaway message from this session is that as a couple, when you all are planning a second pregnancy, you people need to think on various aspects. The first aspect being the physical readiness of the mother. And for that physical readiness, your body to become fit, you have to give a minimum time of 18 to 24 months. Now, this waiting period of 18 to 24 months between the two pregnancy also gives you an added benefit of your first child growing a little more bigger, a little more understanding, and there will be no behavioral issues with the first child if you plan your second pregnancy in the right time and you take the transition in a very positive way. The second takeaway message is to arrange your finances well, because with the second child coming in, you will also have an extra burden, and that will also mean that you will put an additional financial stress on yourself, and the first baby also will not get a few things which the baby was used to getting earlier. So your finances should be right. The third thing is require full support of your family, and you also require an additional help to get in so that you can manage everything well. And the fourth and the most important thing is preparing your first baby to welcome the new child, because initially, when there was no other child in the family, your first baby was getting maximum attention from all the family members. Slowly, slowly, that attention will go low and the attention will be shifted towards the second baby. So, this transition sometimes induces a bad state of mind in the tender minds of this first child. So the transition has to be very slow. It has to be made accommodative, and it has to be in a very positive way, so that the first child does not get into any behavioral issues like aggression, crankiness, they become antisocial, they start getting introvert and things and like that. And the last and the final thing is to have time for both of you as a couple. That is also very important, because when a woman becomes a mother of two child, she just forgets the intimacy which they shared as a couple. So the entire journey or the entire experience of two pregnancies along with the women has to be maintained very well with support of everyone in the family. Thank you. I would finally advise all of you to download the Baby Chakra app. Follow me on the Baby Chakra platform using the referral code SHWETAS for articles, and you can get all your queries solved. Also, if you want to get connected to me personally, you can get connected to me on my social media platforms, Facebook and Instagram, using the following ID, Dr. Shweta.social on Instagram and Facebook. Also, you can use my personal website www.drshwetashah.com to get connected to me personally in matter of any women related queries. Thank you, and it was a pleasure interacting with all of you. Thank you, Baby Chakra, and wishing you all a very happy Diwali and a prosperous new year. Thank you.